I'm Dr. Chui Chan Hon. I'm a senior consultant pediatric surgeon and I practice in Mount Elizabeth Hospital. Pediatric surgery is really the treatment of children's condition with surgical techniques or methods from the age of birth to up to the age of 18 years. So the common types of pediatric surgical conditions include congenital conditions, which are actually growth defects that children are born with, as well as acquired conditions such as infections or growths and tumors. For the first group, which are congenital conditions, these are actually growth defects that children are born with. And these include a wide range of conditions that may encompass the defects in the intestinal tract, where we have conditions called atresias, where the passages are not opened up, Hirschsprung's disease, whereby they were born with insufficient nerve cells, or even other types of cystic abnormalities that the children are born with. Then the other group will be the acquired ones, which are really the swellings or growths that some of these children are later on found to develop, or some of them may have tumors and cancers that we later on will encounter. Besides that, there are also conditions whereby children acquire infections, such as infections of intestines or the appendix, whereby surgical treatment is required. So one of the biggest development is actually in pediatric surgery subspecialization. Because of subspecialization, we do have pediatric surgeons who are specially trained and updated in certain aspect of pediatric surgery. So as a result of that, we are able to bring to the child the state-of-art treatments in these special conditions. And besides that, we also look at the great development in minimally invasive surgery. And because of minimally invasive surgery, we do operations with smaller cuts and smaller wounds, and so that to help these children recover faster. On top of that, we also have a great development in pediatric anesthesia, and that actually helps us to allow these children to go through anesthesia safely, and many of them, because of that, they actually recover much faster. So many of our operations can end up doing ambulatory surgery or outpatient surgery, not requiring hospitalizations. So that's quite a lot of developments in pediatric surgery. So the first key factor here is the patient's condition that requires surgery. So the pediatric surgeon will have to decide what is the best method for the child. And on top of that, then we also consider the child's age, the child's needs, because some children are more fretful than the others. Some children may require more care before surgery, during anesthesia, and after surgery. And finally, I think we work closely with the parents and we look at the parents' needs, and we adjust our treatment methods according to the parents' requirements as well. One of the reasons why pediatric surgery is easily done in Mount Elizabeth Hospital is mainly because it is a tertiary care facility, whereby we have all the facilities and manpower to handle complex pediatric surgical conditions. So we have doctors in all subspecialties in pediatrics, and these are important personnel who can support the treatment of pediatric surgical treatments. Besides that, I think we have in the ward nurses as well as staff who are very familiar and well trained in managing children patients. In addition, we have very good and new scanning machines that we acquired that, for example, have lower dosages of radiation in, for example, like in CT scans and many other types of imaging techniques as well. Besides what I've just said, I think we usually would hope that the children will be spend least amount of time in the hospital, because we believe that the children's spending more time out of hospital would be better for the child's recovery. So we try to allow the children to if possible, to be discharged early, and that's where good anesthesia and good surgery comes in, and they allow the patients to spend less time in the hospital.